1970, the criteria for high blood pressure was 160 over 90. That's when the doctor started talking to you about your high blood pressure and whether you should take medications. There was another method of knowing if you had high blood pressure, especially as you got older, was the systolic number had to be 100 plus your age. So if you were 70 years old, it was perfectly acceptable to have your blood pressure 170 over something. As long as it was lower than that, everything was A-okay. Then somehow, about 30-ish years ago, when I was in school, the numbers changed to when you were supposed to give someone medication. We were taught in our school that when someone had high blood pressure that was 140 over 90, that's when you were to send them out to their primary care doctor and have them take medication. Well, then in 2017, something happened. And that is, a study came out that said people's blood pressure should be lower than 120 over 80. Now, that is a pretty lofty goal. That is very low, such that almost hardly anyone can pass that. When you go into a doctor's office in the middle of the day, you've already had stress. You're already stressed about being there. Maybe you've been waiting in the waiting room too long. You've probably had coffee or some type of food prior to that appointment. Then they rush you into the room, usually put the blood pressure cuff off over a number of clothing as you're dangling there, as they're asking questions. There's a whole host of reasons why your blood pressure is going to be above 120 over 80. If you are above 120 over 80 now, you're going to get a talking to. You're going to get a little spanking, little slap on the wrist. The doctor's going to talk to you. But if you're above 130 over 80, now that's the criteria for medication. Now let me know what your opinion is. Is this simply corporate greed from pharmaceutical companies to lower the margins so low that almost no one can pass, and thus every one of us should be on blood pressure medication? Or are the pharmaceutical companies so altruistic that they just want to help humanity that they've made the criteria such that they're really saving lives and preventing us from having a heart attack or stroke? Let me know what you think is the answer down in the comment section down below. Hypothetically, this may be true. No matter what our age, maybe all of our blood pressure should be below 120 over 80. There is probably a way to get your blood pressure to normal for you, but the million-dollar question is, what is normal blood pressure? What should our blood pressure be when we're 20 years old? What should our blood pressure be when we're 80 years old? And whatever your opinion is, there's probably research to support that. In fact, for many people that are elderly or old, it's interesting that now they're starting to say, or at least there's some research to support, that your blood pressure should be higher, that people that have low blood pressure, because they're on so many medications, are actually having less health and dying sooner than the people with higher blood pressure. So, go figure. But that's the history of what we've seen so far, just in my lifetime. Now, what were they doing 100 years ago in the 1920s with high blood pressure? Were people dropping dead like crazy because of high blood pressure? And now that we're getting everyone below 120 over 80, we're all living longer lives? Is that the reason why people are living longer now? Are they living longer? These are great questions to ask, and I'll leave it up to you to try to read between the lines.